Hi, mamas. I'm Dr. Lauren Luke. I'm a women's health physical therapist. I specialize in pelvic floor dysfunction and spinal dysfunction, and I'm here to chat today about cesarean sections. A lot of my patients that I see in my clinic come in complaining of pain that they're still having at the incision site. And they're also complaining of bladder issues and bowel issues, low back pain and hip pain. And this is due to the sensitivity of the nerve endings surrounding the scar tissue, and because the scar tissue might actually be restricting movement of the other tissues and creating a lot of tension and tightness in the abdominal region, and which all connects to the back in the hips. So the first thing we should talk about is that it's important to try to start desensitizing and touching just even around the incision site as soon as possible. So this can be done, between weeks 1 and 3. And so if you can see here on my hand, I have a little incision that I made. So we're pretending like this is my lower abdominal region where they made an incision site to get the baby out. And you can start to just gently touch around this area, okay, to start desensitizing the skin so it'll be less sensitive, okay? Just touching. You can use, and then you might want to use different fabrics. So you might want to start with a very soft fabric, and maybe like a little cotton ball, just kind of rubbing around this area for a couple minutes every day. And then you might move once that feels fine and normal, then you might want to move on to something a little bit more coarse. So you can start with maybe like a makeup brush. So you could do a makeup brush around the incision site, and then eventually move on to like a toothbrush. So something really coarse and a little bit more rough around this incision site, okay? Then as the scar tissue is healing around week 4, you can start to mobilize around the scar. So doing little circles around the scar like this with your hands, just with a couple fingers, just like this. So moving the skin. So I want you to do this right now. Open up your hand like this, so that your knuckles aren't flexed and closed, and move your skin. See how much movement occurs? Now make a fist and try to move that tissue. Okay, so when you have a fist, it feels more restricted, and that's what happens when the scar tissue starts to bind to the other tissues. We cannot get rid of the actual scar tissue, okay? So I just want you to know that the scar tissue, the scar is there. We're not going to get rid of it. But what we want to do is we don't want that scar tissue to bind down to the other tissues and restrict your mobility, okay? And then, because that can cause pain. I just wanted you to feel that. So a couple minutes a day, just rubbing the scar tissue, and you can go side to side, maybe make some crosses, do some circles. Then at week 6, it should be healed, okay? So you should be going in for your 6-week visit, and the actual scar should be healed. And then when the scar is healed, then you can actually touch the scar, and you'll do the same little circles for a couple minutes every day, some little crosses side to side, just to get that scar tissue moving, okay? So hopefully that was helpful, and you can understand what you can do the first 1 to 6 weeks before you even get into to see a pelvic floor physical therapist. You can start to do these treatments on yourself so that they can help prevent low back pain and abdominal pain and bladder issues and bowel issues. All right, So, bye-bye.